Hello. Uh, in the quest of making people aware about diabetes and other lifestyle diseases and attracting them to more and more scientific knowledge, here we meet again. Today the topic we are going to discuss is diabetes and infections. We know that diabetes affects many of the vital organs of the body, but it is also dreaded for its propensity for infections. Not only does it weakens the immunity, weakens the defenses and gives rise to infections. If a diabetic has an infection, it's more likely to be more severe and fatal. Let us take a couple of infections which are very often seen in diabetics. Let us take the genitourinary infections first. We know that there are some symptoms which show or which attracts one's attention to the presence of diabetes. Those are diabetes related symptoms or diabetes defining symptoms like you have excessive thirst, excessive hunger, there is one might lose a lot of body weight, excessive urge to urinate. All these are usual diabetes defining symptoms. The diagnosis of diabetes may be made through frequent genitourinary infections. We know that vaginal infections or balanoposthitis, as it is known in men, the infections of the male organ, are the infections which attract the attention towards the possibility of a diabetes in patients. So, genitourinary infections are very common in diabetics. In fact, they can become a reason in diagnosing diabetes, and urinary infections in diabetics can become very severe. In fact, they can lead to an acute renal shutdown or an acute shutdown of the kidneys and may turn fatal even. So, urinary tract infections are generally caused by organisms like E. coli, Klebsiella, etc. E. coli is an organism we know that which occurs in the fecal matter of human beings. So, that E. coli is the most common organism that causes urinary tract infection. So, urinary tract infections in diabetics should not be taken casually. They should be well treated, and if there are any structural reasons behind repeated urinary tract infections, like there is stone disease or there are other diseases or structural abnormalities which are interfering with proper voiding of urine, those should be recognized and treated. And whenever there is a urinary infection, it is good to have a urine culture done, and according to the culture reports, treat with the proper antibiotic which is sensitive to the particular organism. So, it is important then we use the proper antibiotic for the proper length of time, and sometimes the people who have a very refractory urinary tract infections, the treatment duration has to be rather long, like we may have to treat for 6 months or 3 months even. So, that is about urinary tract infections. Now coming to another set of serious infections which happen in diabetics, that is the infections of the lower limb or the legs. We know that the diabetics, the biggest problem with diabetics is their insensate foot. That is, the sensation in the feet of diabetics may be minimal or may be impaired. So, small wounds or small problems in the legs may go unnoticed. We see that interdigital space, that is the space between the two toes, that is very highly likely to get infected because of the continuous retention of moisture. A fungal infection happens, and then there is a bacterial superadded infection on top of that, and that is the starting point of a serious foot infection in many of the diabetics. Or you can have a bad footwear which rubs and gives rise to a shoe bite, or you can have a crack in the foot which eventually gets infected. All this can lead to a serious foot infection which can ultimately result in an amputation, which is of course something we do not desire to happen. So, if we take diabetic foot infections, there are a couple of factors which make it worse. One is improperly controlled diabetes. Second is the lack of sensation or the neuropathy, which results in insensate foot or feet which do not perceive sensation properly. So, these wounds and problems, web space infections, etc. may go unnoticed. And then there is a lack of blood supply, which results in antibiotics not properly reaching the wound site and making the treatment more difficult. And at times we see that the foot or the toes, they give for gangrene, that is total lack of blood supply. We can see a black tissue, a black toe there, which needs to be removed in order to curtail the infection or control the infection. So, that is another dreaded form of infection in diabetics, which needs to be urgently addressed. First is a proper inspection of the feet every day. If the patient is not able to look at his feet properly, then somebody in the family should take over that task and have the foot examined every night. And a smallest of problem, a smallest of discoloration should be brought to medical attention. Another set of infections which are seen are the head, neck and face infections. We know that there are ear infections. There is a serious form of ear infections called otitis externa or malignant otitis externa, which can that is the infection of the external ear, which can even lead to an infection to the brain. So, this external ear infection has to be taken very seriously and treated very promptly. And we have inner ear infections or middle ear infections, which also happen in non-diabetic population, but in the diabetic population it tends to become more severe. Now, coming to the lung infections, COVID brought in a lot of attention to the lung infections, and we saw that people who had diabetes and long-standing diabetes and diabetes with obesity had a very high chances of getting a very serious infection, going on to oxygen therapy, and even there were more chances of infection becoming fatal. So, any infection, even lung infections, pneumonias, which can otherwise be well controlled with proper use of antibiotics, may become very severe in diabetics. And so, any infection for that matter, even an upper respiratory tract infection which is not settling down after 3 days of home remedy, should be brought to medical attention. And when treating every infection, that a very important thing that has to be kept in mind is proper control of diabetes. Unless one controls the diabetes properly, the antibiotics, the antivirals, the antifungals are not likely to work. Now, we have some viral infections, like we have chickenpox virus. The same chickenpox virus, a few of those viruses after a long time, which were otherwise dormant in the body, may get reactivated and cause something called as herpes zoster, that we see very commonly in diabetics. In fact, herpes zoster, when it occurs, we think that there is a weakened immune system in the body. So, this herpes zoster comes in the form of few vesicles resembling the vesicles of chickenpox, and they happen on a particular nerve distribution, and there is an intense neuralgic pain or a pain pertaining to that particular nerve that happens with herpes zoster. So, this not only need to be the virus needs to be treated, but sometimes we have to give drugs for this post herpetic neuralgia, that is the pain arising from that particular nerve, and which lasts for even weeks and months. So, one may need to address that neuralgic pain separately in the form of drugs like gabapentin or pregabalin or other agents which we use to control the nerve pain. So, an infection anywhere is more likely to become serious in a diabetic than a non-diabetic. Diabetics have a weakened immune system in the form of a weakened cell mediated immunity and a weakened antibody mediated immunity. So, it is very important that a diabetic has his blood sugars on target from day one, And it is also important that one recognizes any infection in the body early and brings it to medical attention. There are a couple of vaccines which we suggest normally to diabetics, like in some individuals who get recurrent respiratory infections, other respiratory issues as well, we suggest a pneumococcal vaccine. We suggest an influenza vaccine yearly. So all these vaccinations have to be considered under medical supervision and on advice from the treating physician. So this is a topic with a very vast scope. I think the basics I am able to cover, and next time one gets an infection, please take care of it before it gets serious and bring it to or take medical help before it becomes it becomes fatal, or it takes away a limb or a toe for that matter. Thank you.